I'm Zoe, and I'm going to be talking about how to do a breast exam, axilla exam, abdomen, and genital exam for my makeup lab assignment. I'm going to start with the abdomen exam. There are 4 aspects of the exam, which is observation, palpation, auscultation, and percussion. I'm going to start with observation because that's the least intrusive method, and you want to start off with the least intrusive one to make your patient feel more comfortable. So I will look for any observable distension or rashes or bumps in the abdomen. Next, I'm going to auscultate in each of the 4 quadrants to listen for bowel sounds. If there is an obstruction or partial obstruction in your bowel, then you will hear a sound that is of higher frequency and more tympanic. Next, I'm going to palpate. So palpation is a really good way to figure out if there is inflammation or tenderness in any of the abdomen organs. In the right upper quadrant, you have your liver, your gallbladder, and your pancreas. So if they have tenderness in the upper right quadrant, it might be an infection or an issue with one of these organs. The pancreas is situated more posteriorly, and so if they get radiating pain to the back, then that's more indicative of pancreas inflammation. In the left upper quadrant, you have the spleen. In the right lower quadrant, you have the appendix and your right ovary. And then your left lower quadrant, you have your ovary and your bowel. So with bowel inflammation, though, you're likely to get generalized pain in your abdomen as opposed to just situated in your left lower quadrant. So be mindful of that. In older people, they get something called diverticulitis, which is pocketing within the wall of the bowel. It's because they have muscle atrophy and their skin, like the elasticity of their skin gets a little bit less. So you get pocketing between the muscle of your bowel, and then those pockets can build up food and get infected. And so if they have right or left lower quadrant tenderness, then it may be that issue. With auscultation as well, you need to watch for high tympanic noises because that means one of the organs are likely inflamed. So then another thing that is common is guarding, and so when you palpate the area and you get involuntary muscle contraction and then they pull away from you and it's like tense and tender, that's called guarding. This can be caused by generalized inflammation or an appendicitis, or peritonitis, which is infection of the abdominal cavity, or cholecystitis, which is infection of the gallbladder. It also happens with a perforated bowel or perforated ulcer within the bowel. So watch out for those things. So with the abdomen assessment, you want to also ask them when was the last time they had a bowel movement, the quality of that bowel movement, so if they had to strain or if it was really hard or really soft like diarrhea, if there was any blood in the bowel or in the stool, and if their schedule of bowel movements has changed significantly in the past few weeks. You also want to ask them about their urinary continence, so if they can hold their pee, when was the last time they voided their bladder, what the color was of their urine, and whether it hurt when they urinated. If it hurts when they urinate, it could be a UTI or it could be an STI or something else. So that is the end of my abdomen exam. Next, I'm going to move on to the axillae, which is under your arms right here, your armpits, and that's where a lot of your lymph nodes are situated. So a really important assessment here is palpation. If you feel hard or like a more hard lump and it's really tender, it's likely that your axilla or your lymph nodes within your axilla are inflamed, and this happens if you have an infection, like a generalized infection of your body. It could also happen if you have cancer, which is less likely, but also a consideration. So you need to know which lymph nodes are within your axilla as well, and ask them if it's tender at all. So next I'm going to talk about the breast exam. So generalized, you can palpate the breast, starting high and going low, making sure you get under the breast and around the edges. to look for any bumps or lumps or tenderness. So generalized tenderness of the breast could mean that they're starting their period or that they are pregnant. Just changes in hormonal levels can cause generalized tenderness, and it's not usually anything to worry about. If you find a lump, it's either going to be a tender lump or a non-tender lump. So tender lumps can be blocked lacteals, which happens when you're after you've given birth and you're breastfeeding, and this is called mastitis. So they can be infected lacteals, which can be very painful and affect breastfeeding. One of the ways you can deal with this is by putting a warm, like washcloth or warm compress on it. Non-tender lump can either be one of the two of the many things it can be is either a lipoma or breast cancer. So a lipoma is just like a fat deposit under your skin, and it's not really a concern unless it gets big and like affects it like bothers you. And if you feel the lump, the non-tender lump, and it moves with your skin, then it's likely a lipoma. But if it's a hard lump that doesn't really move and you move the skin over it, it could be breast cancer as well. So a really good intervention is to teach women how to give themselves a breast exam and what the signs of breast cancer are, and then what to do if they feel a lump, which is go and see a healthcare professional. You want to look at the breasts as well and see if they're symmetrical. Well, a lot of the times breasts aren't actually symmetrical, so asymmetry is okay, but if there's a change in symmetry, then that could be something to further examine. If you see orange, so it kind of looks like the peel of an orange, that usually means that there's a tumor under the skin in the breast, so that is definitely something you want to examine further. So also in the breast, if you see that it's red, hot, tender, swollen, that could be an infection. If you have just given birth, it could be mastitis. If you aren't pregnant or haven't given birth, it could be another sort of infection. So watch out for that. In teenagers, female teenagers, starting at age, I think about 8 or 9, but older than that as well, they can start developing breasts. So they get what's called a breast bud, and it's kind of a hard ball in the middle of your chest, which will then develop into breasts. It's really important to teach like young girls what this is, because a lot of them, it can cause them a lot of anxiety. They think it's cancer if they're not sure what it is, or like a change in their body that they don't know the reason for. So you want to make sure that they're comfortable with this and understand what's going on. They're going to be tender, but if they're extremely tender and they look red, swollen, or if they have discharge coming out of them, then that's something that is of concern and you should look into more. Males can also develop breast tissue, and it's not much of a concern, but again, you should be doing breast exams on men as well, because they can also get breast cancer. And just, doing the same thing that you do with women. And you also look at the areola color, the size, the shape, the symmetry. Again, asking if there's been changes in any of those things, because most people have different sizes and shapes and colors, but a recent change in one of those is a flag for further investigation. Okay, so the next one I'm going to do is the genital exam. So for men and women, it's equally important to do the genital exam. You want to start by looking at, for women, you can look at the labia, majora and minora. Some women may be concerned that they are of different sizes, but that's completely normal, having them different sizes, kind of like your feet being different sizes, so that's not really an area of concern. You want to look for tenderness, redness, swelling, any weird discharge or abrasions down there. Those could be areas of concern, or discoloration. With the genital exam too, you're always looking out for STIs. So a lot of the STIs are asymptomatic, which means that just because they don't have something down in their genitalia does not mean that they are STI free, which is a good thing to educate them on. But if they have like tender fluid-filled vesicles, that may be herpes. If they have weird smelling or discolored discharge, or like really different discharge than they usually have, that can be gonorrhea or chlamydia. If it hurts to pee, that's also indicative of an STI. Syphilis has a lot of different stages and a lot of different symptoms that come with those stages. So the first stage, you get kind of flu-like symptoms sometimes, and you get, I think you get some warts sometimes, but it can be asymptomatic as well. The second stage is latent, and then the third stage, if you get rashes on the palms of your hands, that is also a good sign of syphilis, because not many other things you get rashes on the palms of your hands, except hand and foot or foot and mouth disease, and other things, I'm sure. Those are just the two that I know of. So with the genital exam, you also really want to check for hemorrhoids, especially in people who are in wheelchairs or who are in bed a lot, so older people. And hemorrhoids are just like the vessels in your anus pretty much poke out the bottom, and they get red and inflamed and swollen and really tender, and they're painful. And they can bleed sometimes as well, so you can put hemorrhoid cream on there. Sometimes you need surgery if they're really bad. I think you can put warm compresses. Just make sure you're changing positions as much as possible to help with those hemorrhoids. For postmenopausal women who have stopped their periods, you want to ask them if they have had bleeding after their periods have stopped, because this could be indicative of uterine cancer, and you want to go in for a biopsy if they have postmenopausal bleeding. You also want to check for colon cancer. So the reason why we are so adamant on screening for colon cancer is because so often it's asymptomatic until the very late stages. And so just because somebody's colon looks normal with no bumps or no discoloration or tenderness does not mean that they do not have colon cancer. But in the late stages, it can cause blockage within your colon and bleeding. So if they're unable to pass gas, or if it's like it hurts when they have a bowel movement, or it hurts when they sit down, then you should investigate a little bit further. For males, looking at their testes, you want to look at the size of the scrotum, the shape, smoothness, and presence of masses. Yes, and that is it for genitalia. And those are the four assessments that I wanted to talk about. So thank you so much again for letting me do this makeup assignment, and please let me know if I missed any information or if any of the information I said is inaccurate. Okay, thank you. Sorry, I also forgot to mention that with palpation of the abdomen, you want to start, so you put one hand over the other, and you want to push with your upper hand instead of your lower hand so that you can maximize the feeling within your lower fingers. And you want to start by pressing down really gently in case there is a lot of tenderness or an issue within their abdomen that if you press on could exacerbate it. So you start by pressing really lightly, and if they don't express pain or discomfort, then you press a little bit harder to get deeper into the abdomen. And then you want to palpate each of the four quadrants. Again, like what I said before. Yes, and that is what I want to add. A final side note that I wanted to add is that it's also important to do a genital assessment with infants and babies. Especially male babies can get hairs wrapped around their penis or their scrotum, and it can cut off blood circulation and cause damage. So you want to make sure that there's no redness, or if the tip is getting a little bit blue, if there's like a line of red, make sure there isn't a hair wrapped around it. Okay, that was my final edition.